Hey everybody, so day three, um, the swelling hits. I'm not going to sugarcoat it. The way I would describe it is imagine someone has poured Jello pudding down inside your leg, and your skin is acting as like the balloon cover. And so you're feeling all this tension and stress from having all this extra Jello pudding in your leg, and it's creating resistance against every single muscle, ligament. Well, I shouldn't say everyone, mainly in my calves, my calf, left calf, and my thigh, so the quad. Yeah, especially the quad. And the other thing to keep in mind is, on the bright side of things, that constant pain I would feel inside my left knee for years and years and years and years, that's gone. So it's the first sign that, hey, this knee replacement really did something great and worked well. So the interior knee pain is gone, but you've got the swelling now to deal with and this post-surgical stuff to deal with. So anyhow, third day, my first official physical therapy appointment was 9 a.m. And it was with a physical therapist by the name of Murray, an Aussie, a really super nice guy and extremely informative. If I had any question and asked him, he was more than happy to answer it and tell me what everything was all about. And that was great. And he looked at the swelling because I had brought that up to him, and he said, "Oh, I've seen worse." Well, I guess since I'm going back and doing some of the earlier days, I can tell you. And the worst will be you in a few days. Because at that point I had swelling, but I don't think I had any signs of bruising, not yet. But I guess that's some up and coming information. Murray basically goes through an assessment and he tries to see what your range of motion is. And I feel like the range of motion I had was not as good as it was on the hospital during surgery day, because now you've had a couple of days of swelling to kind of impede your range of motion. I'd say you got to look at it as glasses half full or better than that, because I had been living with knee pain for over 10 years, and that pain that was inside my knee is gone. So in the grand scheme of things, okay, I'm feeling like I've got this post-surgical recovery to get through, but mission is accomplished. Life is good. I'm moving forward. Murray had given me a whole bunch of exercises to do that included, I guess at this point, the two exercises I was doing the most, because I could do them even if I was sitting in the recliner, are the ankle extensions. The ankle extensions really help your calf, and then like the quadricep push, where you're trying to use your quadricep to push down against the back of the recliner table. And the whole theory of this is movement. Movement is your best friend. Movement gets blood flowing through your leg. The blood brings, oxygen and good stuff to your leg and takes the bad stuff, the swelling and the fluid and that stuff away. So movement is key. Movement is important. It was great to hear Murray reiterate that. As I have a friend who used to be a physical therapist. Her name is Vicky, and she had basically commented about the same thing. So I'd heard it from several different people. And so if you're wondering, you're going to hear it from me now also. Movement is the best thing. When I was feeling the tension and swelling and stress, by repeatedly, constantly, more than frequently doing those ankle extensions, because like I said, you could do it when I was sitting, I could literally feel the swelling was nowhere near the level in my calf as it was in my quadricep or other parts of my thigh. And so that was the light bulb moment for me that, hey, I had to do the other exercises that would help alleviate the swelling and the discomfort that was coming from my quadricep and thighs. So, you know, still a lot of napping. Your body has gone through a lot of trauma because of the surgery. So, PT, swelling, napping, and hopefully optimistic viewpoint on what's been happening. And for me, also, the realization of how important your support system is. My wife had been, it's really, really, really great. She's been great through this whole thing. And hope you all get someone that'll really help and support you through this, because there's a lot of things you used to be able to do, and your brain still thinks you can do it, and your body's going, not so much. But still, overall, positive, moving forward. The pain that you've been living with is gone. You just got something else to deal with, and you know eventually that's going to get resolved too. Thanks.